My name is Goefe. This is Brilliantist. I'm bringing you internal medicine video series MCQ. Question number 1. Mr. Masawe is a 38-year-old man with alcoholic liver disease presented to the district hospital with hematemesis, and he had mild gastric pain. On examination, he had spider nevi over his chest wall and was clinically jaundiced. There was no hepatomegaly and no ascites on examination. His heart rate was 110 beats per minute, blood pressure of 90 over 50 millimeter of mercury, respiratory rate of 20 beats per minute, and oxygen saturation of 96%. That's normal on room air. Investigation: HB 11 gram per deciliter, white blood cell 10.5, P platelets certified that's very low, international normalized ratio of 1.4, activated departure thrombosis time 44 seconds, and fibrinogen 1.9. What is the most appropriate way to manage his coagulopathy? The answer is C. Platelet transfusion, because hematemesis is due to no coagulation, hence the patient is vomiting blood. Question number 2. A 65-year-old male presents to the neurology outpatient department with a history of recurrent bouts of unsteadiness in vomiting over the last 10 years with partial resolution. He has also had episodes of visual problems, which he describes as the sudden loss of vision in the right eye, with an almost complete recovery of vision over the course of the next few weeks. He has a history of type 2 diabetes and is hypertensive and is generally non-compliant with his treatment. He is also a smoker with a 50 packs per year history. His medication includes Greenpride 2 mg daily and metformin 500 mg TDS. He also takes telmisartan 40 mg daily. On examination, he has nystagmus in the right eyes, with the first component toward the right. His gait is ataxic and he has evidence of spasticity in both lower limbs with exaggerated reflexes and bilateral ankle clonus. Fundoscopic examination reveals a pale optic disc. MRI brain show diffuse lesion in multiple sites. They reported quelled demyelinating plaque versus myelinating infarct. Which of the following would be the most appropriate next investigation? The answer is A. MRI of the spinal cord. You need to do this also, because this is a neurological issue. Question number 3. You are called by a nurse to review a patient in the stroke ward. He is a 75-year-old who suffered from a right-sided intracerebral hemorrhage the previous day. The nurse staff were concerned due to a decreased consciousness level. On examination, you note a right-sided dilated pupil and a left-sided hemiparesis. His Glasgow Coma Scale is 13, motor 5, verbal 4, eye opening 4, MVE. What is the most likely diagnosis? The answer is none other than ankle hernia. This is the hernia in the brain. The brain That's why. Question number 4. Mr. Mkali, a 47-year-old man, is referred from emergency department with increasing shortness of breath. He is non-HIV patient managed by the local general practitioner. He is not on any antiretroviral treatment. He presents with a 2-week history of worsening shortness of breath, and he is now breathlessness. On minimal exercise, his business. He has a non-productive cough and has felt lethargic for the last week. On examination, he is febrile. His blood pressure is 110/89 mm of mercury, and he's slightly tachycardic at 110 beats per minute. His respiratory rate is 18 breaths per minute at rest with saturation of 98% in room air. When he mobilizes to the toilet, he becomes very tachypneic, and his saturations drop to 90%. His blood tests are as follows: HbA11 platelets 201, white blood cell count 9.6, neutrophils 4.5, sodium concentration 138, potassium 4.1, urea 7.4, 4.8, creatinine 20, CRP 70, bilirubin 5 macromoles, ALP 89, ALT 43, albumin 34, and an ABG is done at your blood gas, which shows pH of 7.35, partial pressure of oxygen 7.7, and partial pressure of carbon dioxide 4.6, hydrogen carbonate 21, lactate 2.2. His chest X-ray shows fine bilateral reticular nodular shadowing. What is the most appropriate treatment to start in this patient? The answer is D, cotrimoxazole and corticosteroid, because the patient is likely to have PCP, pneumocystis jirovecii pneumonia, PJP. A 64-year-old woman is evaluated in the emergency department for hours after abrupt onset of sharp tearing chest and back pain. Medical history is significant for hyperlipidemia. Her only medication is atorvastatin. On physical examination, temperature is 36.8 degrees centigrade, blood pressure of 173 out of 99 mm of mercury, and pulse rate of 90 beats per minute. Blood pressure measurement in both arms are equal. The remainder of the physical examination is unremarkable. CT angiograph shows a descending thoracic aortic aneurysm with a maximal diameter of 6.8 cm and aortic dissection originating just distal to the left subclavian artery and extending to just below the diaphragm. There is no involvement of the renal arteries. Which of the following is the most appropriate initial management? The answer is C. You should just start with medical therapy as an initial management to control the blood pressure and etc. Okay, question number 6. Juma is 23-year-old from Kigoma. He presents with the acute onset of fever, skin lesion on his extremities that are purpura and erythematous, with a hemorrhagic and necrotic center, joint pain, and an acute tenosynovitis of the dorsum of his left foot. He has no past medical history and takes no medication. He does not smoke, drink alcohol, or use illicit drugs. On physical examination, the patient has temperature of 39.1 degrees centigrade. The temperature is high. Passive flexion and extension of the left great toe causes severe pain over the dorsum of the midfoot and ankle. Which of the following is the most appropriate diagnosis? The answer is D. Disseminated gonococcal infection. This is not gouting, because as you can see, it involves the dorsum of the foot. Like, look at the history. This is disseminated gonococcal infection. Question number 7. Your aunt is 34-year-old. She was recently told by another physician that her blood test was positive for Helicobacter pylori. She completed a course of medication but is concerned about this finding. This patient is at risk of which of the following? The answer is E. Mucosa associated tissue lymphomas. This is condition occurs when H. pylori is in the blood. Question number 8. A 48-year-old nurse presents to your office complaining of a poorly healing ulcer of her left second dict. The ulcer started a week ago and is painless. The patient has tried using over-the-counter antibacterial and hydrocortisone cream without improvement. She denies trauma to the hand. The patient has a temperature of 38.4 degrees centigrade. That's increased. Left-sided epitrochlear and axillary adenopathy. She has a 4 centimeter ulcer on the dorsal side of the left second dict, covered by a black eschar and surrounded by an extensive amount of non-pitting edema. Which of the following is the most likely diagnosis? The answer is B. It's cutaneous anthrax that can cause all that. Question number 9. Miss Jane is a 67-year-old woman present to your clinic with complaints of painful hips and shoulder as well as headache. She read that the muscle pain is felt on both arms and hips. She feels that her shoulders are stiff and the hips cannot move when she wakes up. It almost takes 40 minutes of painful physical activity for the stiffness to end. Her appetite is decreased and she has lost 5 kilograms. To make me more miserable, the terrible headache has just been started. She mentions the headache is felt on the right side and is throbbing with no response to analgesics. On physical examination, she is noted to have painful restricted movements of shoulder and hip joint bilateral. Her right temple is tender to touch. She is not febrile and the rest of the exam is inconclusive. Which one of the following would be the most appropriate next step in management? The answer is C. Check erythrocyte set mentioned red. Check the acute infection. At least you can do something and then continue with the other. Question number 10. A 43-year-old gentleman who is admitted and found to have ST elevation myocardial infarction has chest pain on the ward. He is currently recovering from his percutaneous coronary intervention the day before and has fared well until now. The pain is over the left side of the chest and severe if he breathes. He has no cough or fever and his observations are within normal range limits. On examination, he has normal heart sound and a clear chest. He is mildly tender over the chest wall. His femoral puncture sites are clean with no hematoma. He is sinus reading on the cardiac monitor and has soft non-edematous calves, no jugular venous pressure seen. Lab results show sodium concentration iron 156, potassium 3.4, urea 5.6, creatinine 78, CRP 45, HB of 13, platelets of 398, white blood cell of 13, and ECG show a sinus reason. T-wave inversion in V1 to V3, pulse rate of 180 beats per minute and flat in most leads. The chest X-ray has clear lung field. Heart is at the upper limit of normal size. The heart is trying to enlarge. What is the likely diagnosis? The answer is B, pericarditis. That is inflammation of the pericardium. Subscribe, hit the bell sign, like and share our video. You're always me, Godfrey Oscar, on Brilliant East. You are warmly welcome.